You schedule a routine checkup. Your doctor orders 5 tests. You say yes automatically. But what if I told you that after 70, saying yes to every test could actually shorten your life? I'm here to share something the healthcare system won't tell you clearly. At 70 and beyond, the testing playbook changes completely. Tests that save lives at 50 can destroy quality of life at 75. Today, you'll discover which routine medical screenings deserve serious questioning after 70, why standard protocols ignore your actual needs, and the 3 powerful questions that put you back in control of your health decisions. Whether you're navigating your own healthcare or supporting an aging parent, this matters. Because informed decisions aren't about refusing care, they're about choosing care that truly serves you. Let's talk about what really happens when seniors over 70 follow every testing recommendation without question. Section 1. The testing paradox. Here's the medical reality nobody explains properly. After 70, your body operates on different timelines. A screening test works like this: find disease early, treat it early, extend life. Simple, right? Not after 70. Here's why. Imagine a screening test detects a slow-growing cancer. In a 50-year-old, that cancer might cause problems in 10, 15 years, plenty of time to intervene. But in a 7, 8-year-old with an average life expectancy of 8-10 years, that same cancer will never cause symptoms in their lifetime. Think of it like finding a tiny crack in the foundation of a house you're only living in for 2 more years. Do you tear down walls and renovate, disrupting your life entirely, when the crack would never have caused problems during your stay? This is the testing paradox. More detection doesn't equal better outcomes when treatment causes immediate harm and the disease would never have affected you. Yet doctors order the same tests at 75 that they order at 45, ignoring this fundamental difference. The key concept: life expectancy trumps early detection. If a condition takes 15 years to cause problems, but you have 8 years of realistic lifespan, finding it only creates unnecessary suffering through treatment. But wait, doesn't this mean we just ignore health completely? Absolutely not. Later, I'll show you exactly how to have these conversations with your doctor. First, you need to know which tests cause the most trouble. Section 2, the 5 tests to question. Test 1, PSA, prostate screening. After 75, most prostate cancers in elderly men grow incredibly slowly. We're talking 15 to 25 years before they'd cause any issues. According to major medical organizations like the U.S. Preventive Services Task Force, PSA screening after 70 creates more harm than benefit. Here's what happens. Elevated PSA leads to painful biopsies. Biopsies find cancers that would never have mattered. Fear drives aggressive treatment, surgery, or radiation. Guaranteed side effects: incontinence, sexual dysfunction, surgical complications. Zero survival benefit. Picture this. You're 76, active, enjoying grandchildren. A routine test finds slow-growing prostate cancer. Treatment leaves you in diapers and struggling with intimate relationships for your remaining healthy years to treat something that would never have harmed you. Test 2, colonoscopy. After 7-5 with previous normal results. Colonoscopy perforation risk triples in patients over 75. Anesthesia complications increase significantly. If you've had normal screenings before, the chance of developing life-threatening colon cancer in your remaining years is extremely low, but procedure risks are very real. Test 3, routine mammography. After 75. Similar story. Detecting breast cancers that grow too slowly to affect lifespan leads to surgeries, radiation, chemotherapy treatments that reduce quality of life without extending it. The anxiety from false positives alone causes measurable harm. Test 4, aggressive diabetes control. HbA1c under 7 inches. Frail seniors. Visual blood sugar chart showing safe zone changing with age. Tight glucose control in elderly patients causes dangerous low blood sugar episodes, confusion, falls, hospitalizations. Studies show that overly aggressive diabetes management in seniors actually increases mortality. A more relaxed target, 7.5, 8.5, is often safer. Test 5, routine full-body CT scans. just to check. These scans almost always find incidental findings, abnormalities that lead to cascading follow-up tests, biopsies, and surgeries. Research shows 23% of seniors experience complications from investigating these findings with zero survival improvement. The pattern is clear. These tests find conditions that won't affect your lifespan, but trigger treatments that definitely will affect your quality of life negatively. Section 3. Your 3-question protection system. Before agreeing to any screening test after 70, use this 3-question system. Write these down. Question 1. What's my realistic life expectancy given my overall health, not just my age? This is crucial. A marathon running 5-year-old has different needs than a frail 5-year-old with multiple conditions. Life expectancy, not chronological age, should guide testing decisions. If your realistic expectancy is under 10 years, most cancer screenings aren't appropriate. Question 2. If this test finds something, what treatment would follow, and what are the specific risks at my age? Don't just ask if treatment is available, ask what it involves. Surgery? Chemotherapy? Radiation? What's the recovery time? What are the side effects? If treatment risks are high and benefits uncertain, the test itself becomes questionable. Question 3. What does current medical evidence say about this test for people my age with my health status? Demand evidence, not protocol. We always do this, test isn't good enough. Ask, show me studies on patients like me. What were the outcomes? Reputable sources like the American Geriatric Society publish specific guidelines for senior testing. Your doctor should reference them. Here's how this sounds in practice. Doctor, you're recommending a PSA test. I'm 74 with high blood pressure and mild arthritis. What's my realistic life expectancy? Doctor, probably 10-12 years with good management. You, if the PSA is elevated, what happens next? Doctor, we do a biopsy, possibly treatment. What does the evidence show about PSA screening benefit for men my age with my health profile? Doctor, if honest, actually guidelines recommend against routine PSA screening after 70 because harms outweigh benefits. This conversation just saved you from potential unnecessary harm. Section 4. Practical tips and alternatives. Tip 1. Request watchful waiting instead of immediate testing. For many conditions, monitoring symptoms without invasive testing is perfectly appropriate. No symptoms? Question why you need the test. Tip 2. Ask about less invasive alternatives. Instead of colonoscopy, consider stool-based tests, FIT tests. Instead of routine imaging, ask if symptom-based observation is sufficient. Tip 3. Bring a family member or advocate to appointments. Having someone else present helps you remember questions and gives you support when challenging testing recommendations. Tip 4. Get a second opinion for any major screening recommendation, especially if it involves significant risk or you're uncomfortable. A geriatric specialist may have different insights than a general practitioner. Common mistake 1. Thinking you must comply with every doctor order. You absolutely have the right to decline any test. Doctor's orders isn't law, it's a recommendation you can question. Common mistake 2. Focusing only on, what if we find something? Ask instead, what if we find something that doesn't matter but leads to harmful treatment? Common mistake 3. Forgetting that doing nothing is sometimes the best medical choice. Active surveillance, carefully watching without intervening is a valid, evidence-based strategy for many conditions in seniors. Let's lock in the 3 key takeaways. 1. After 70, life expectancy must guide testing decisions. The question isn't, can we find disease, but will finding and treating this disease actually improve your life? 2. Use your 3-question system before every test. Realistic life expectancy, specific treatment risks, and current evidence for your age group. 3. You have the absolute right to decline tests that may cause more harm than good. Informed refusal is just as important as informed consent. Healthcare after 70 isn't about doing everything possible, it's about doing what's actually beneficial for you. Quality of life matters more than quantity of tests. If this information empowered you, hit that like button. and subscribe to Learn Daily for more evidence-based health guidance. Drop a comment. What testing experience have you or a loved one faced after 70? Next video, 5 medications to reconsider after 65, what your doctor isn't telling you. You don't want to miss it. Take control of your health through knowledge. See you in the next one.